Good afternoon, everybody. This is Paul Jones. I am the owner and Chief People Officer of First Light Home Care in Woodbridge. I've had the pleasure of spending time with many of you, but some of you may not have ever met me. Maybe you've talked to me on the phone. But I'm sending you this message today because I want you to be aware of the steps that we are taking to mitigate the spread of and control the infection of the coronavirus or COVID-19. I'm sure many of you have questions. Some of you have already called us, and we appreciate that. But I'm going to start doing these video updates once a week on Mondays, more often if necessary. But this follows up the email that I sent you guys last week. And there's really three main things I want you to know. I'm going to keep it short and sweet. But I do think it's important that you understand the steps that we're taking to keep you and your family safe. And that's really where I want to start. Number one, your health and safety is our first priority. That's the reason we're here, is to build relationships so that you guys have the care that you need and that you can maintain your independence and freedom and health and safety for many, many years. And so to do that, we have a very specific infection control plan that we've always had to make sure that the caregivers that are coming into your home are safe to be there. So in addition to that, during this virus outbreak and while the public health crisis is ongoing, we are very specifically monitoring caregiver symptoms, specifically fever, cough, and shortness of breath, which seem to be the three big symptoms related to any coronavirus exposure. That is part of the CDC Guidelines, the Center for Disease Control, and we are following their guidelines to the letter, especially most recently with regard to social distancing. And so we have canceled all meetings in the community that we would normally participate in. We've canceled all of our marketing and networking activities in the community that we would normally participate in until further notice, so that we can make sure that we're not bringing any possible contagions that we would encounter out in the community back to the office or to caregivers or to you. So we are practicing all of those guidelines that the CDC has put out. And lastly, with regard to our infection control, we are requiring a 2-week quarantine from work and coronavirus testing for any caregiver that's traveled out of the country in the last 45 days. And I'm happy to report, as of this videotape, we have no reported symptoms of any kind of coronavirus amongst our employees. We have no positive tests of any kind amongst our employees, and no symptoms among any of our clients that we're aware of at this time. So if you are experiencing shortness of breath or a dry cough or a high fever, please let us know, and then take the appropriate steps to be seen, tested, and treated by your local physician. So keeping you safe is our number one priority. Number two, our infection control plan. And number three, I wanted to share with you again the information as an attachment to this email that's coming out from the CDC on how you can keep your home and in your environment safe. The reality is, if you do some very basic things, the likelihood of you contracting this is very, very low. Of course, if you're elderly or you have underlying health conditions, your risk goes up. So it's really important for you to make sure that you're following these guidelines. And that's really all I wanted to let you know about today, that we are on top of this. I am personally monitoring this all day long, every day. And if there are any significant changes to our work or to our practices, we will make sure to let you know immediately. And this is the way we will do it, so that you can have it directly from me, okay? But otherwise, it is business as usual here. We never close, and we're here for you, whatever your needs happen to be. So that's it for today. If you have any questions about any of this, please give us a call at our main number. Put that on the screen here below so that you can contact us. That number is answered 24 hours a day, 7 days a week by a live person. And whatever your concerns are, somebody's always on call, and we can get back in touch with you within 30 minutes or so, most usually. Thank you again for placing your trust in First Light, for staying with us during this challenge. We are here for you, and stay safe. And we will be back in touch with you this time next week, or sooner if we need to. Thanks again, and have a great day. Bye-bye.